Good morning all. Now we are going to see a case study of varicose vein. So varicose vein is nothing but it is the twisted veins occurs due to because of prolonged standing overloaded working of the lower limbs. This is the varicose vein. So this is the picture we can see. The lower limbs will be like this. The veins are like a spider like veins. So this is a varicose vein. The definition of varicose vein is the varicose vein or varicositis, both are same, are swollen twisted veins then lie just under the skin. They usually occurs in the legs, sometimes varicose vein from in part of the body, other part of the body. So etiological factors of varicose vein is weak or damaged valves can lead to varicose vein. How the valves get damaged because of prolonged standing, workload, overloaded works, poor perfusion. These are some of the reasons for a vein to get damaged. And then the pathophysiology of varicose vein. The pathophysiology of varicose vein, there are 4 stages. In stage 1, that is reticular veins or spider-like veins. The veins are little bit twisted. That means it won't be a straight line. It will be like a spider. The second stage is varicose veins or venous nodes. There is some amount of nodes we can see. The round-like structure we can see. The third stage, the edema of the lower limbs. The limbs get swollen. And the fourth stage, varicose vein, varicose eczema or tropic ulcers. And that means there is the poor blood supply. Because of that, the skin won't get good perfusion, so it turns into necrosis. Due to various etiological factors and risk factors, the enlargement of vein in a leg which leads to stretching of valves and it becomes incompetent, which leads to backflow of blood, increasing back pressure, cough muscle, pump fails. Backflow of the blood which leads to increased pressure in the cough muscle, so the cough muscle pumping gets failed, which leads to venous distended. The venous distended which leads to edema, that means the swollen lower limbs, that is called pedal edema. So this is the pathophysiological, that means how the normal vein turns into a varicose vein. Then clinical manifestation, that means the sign and symptoms. The veins that are dark purple, that means the color getting changed, dark purple, blue or the same color as the skin. Depending on the skin color, these changes may be harder or easier to see. Veins that look twisted and bulgy, they often look like cords on a legs. And achy or heavy feeling in a leg, burning, thrombing, muscle cramping and swelling in the lower legs. Worsen pain after sitting or standing for a prolonged time, itching around one or more of the veins, changing in skin color around the veins. Spider veins are like varicose vein, but they are smaller. Spider veins are found closer to the skin surface and might look like a spider web. Spider veins occurs on a leg but also can be found on a face. They vary in size and often look like a spider's web. That means the main symptoms are swelling, paining, heaviness, itching, cramps, burning sensation. These are all the 5 major symptoms of a varicose vein. And then complication, if you are not treated, what are the things the patient gets? That means ulcer. Painful ulcer can form on the skin near the varicose vein. A discolored spot on the skin often behind or before a ulcer form. Ulcers. Another one is blood clot. It gets larger and bleeding close to the skin burst. If it is the veins getting burst, the patient gets bleeding. Another one is leg swelling. Long time varicose vein can cause the legs to swelling. Another one is risk factors. The family history, age, pregnancy, obesity and prolonged sitting or standing will cause. These are the risk factors. So this is the stage. Through physical examination, we can able to diagnose this varicose vein. A Doppler is also to find the stages of the varicose vein. In first stage, the vein are little bit twisted like a spider. Second stage, it turns into a node. Third stage, the skin color changes is there. Fourth stage, the skin ulcer is formed. Fifth stage is the necrotic condition of the varicose vein. So, through these physical examinations, the doctor can able to diagnose this condition. Another one is prevention. Don't wear high heels or tight stockings other than compressing stockings. The compressing stocking is good because they are improving they are regulating the blood pressure. Then change how to sit or stand up. Eat a high fiber and low salt diet. Exercise. Raise your leg when sitting or lying down. Keep a healthy weight. Conservative management is elastic bandage, that means compressing stock. It is a socks like thing. By using this, it can regulate the blood pressure in the vessels, veins. Another one is procedures, the sclerotherapy, laser therapy. These are all the therapies. Catheter based procedures using radio frequency or laser ablations. This procedure is the treatment most used for larger varicose vein. Put a thin tube called a catheter into the enlarged vein. Radio frequency or laser energy heat up the tip of the catheter. As the catheter is taken out, the heat destroys the vein by causing it to cave into the shear shut. So this is the procedure. Catheter is inserted in the fluxing veins. Catheter position electrodes are deployed, or that means radio frequency energy initiating veins wall contracted. Catheter slowly withdrawn, closing veins. Veins is physically narrowed. So this is the surgical procedure. Another type of procedure is high ligation and vein stripping. Another one is ambulatory phlebotomy. So this is the procedure for varicose vein. Thank you all.